And infectious diseases specialist Dr. Zain Chagla is here to help us navigate all of this. He works in Hamilton and joins us from Mississauga, Ontario. And Dr. Chagla, first of all, what are you seeing in terms of COVID in hospital?
Yeah, I mean, there are a few more patients than we had at the end of the summer, so kind of in that June, July period. Certainly, you know, the individuals that are coming in are a little bit different. They're not as sick as before. They're mildly ill. They need a little bit of support. They're often making discharge. And I think, you know, from a sheer number standpoint, this is very, very different than 2020, 2021, 2022, where the numbers are still relatively small, more than they were a couple of months ago, but still several fold lower than what we saw even in 2022 at the same time.
So this new variant that's been detected in British Columbia for the first time, how concerned should we be?
So this variant was described a couple of weeks ago. It was a sequence variant in Denmark, and really a lot of countries, when they started looking, were finding a small number, not a huge amount, but a small number of their sequences had the same variant. Now, these are the countries that have access to good sequencing. The fact that they're finding this variant in their countries and places that don't have good sequencing aren't finding it probably suggests it's pretty widespread, especially as we're seeing it in people that have no particular travel history. The good news is, though, you know, this has probably been around for some time because we are detecting it in people that really have not left their particular countries. And, you know, we aren't seeing explosive growth. There was a little bit of data that got released yesterday that suggested perhaps this may evade immunity a bit better, but the ability for this variant to actually infect cells may be a bit worse than currently circulating variants. So still a lot to determine, a lot to question. But the good news is it doesn't seem to be taking off as fast as we would see with other variants that have caused significant concern.
Yeah, that's really interesting. So a lot of us are trying to figure out when to get the next booster for COVID. Variants continue to happen. Viruses continue to mutate. What advice can you give us in terms of timing?
Absolutely. So, you know, for people that are, you know, at risk today, getting chemotherapy tomorrow, they should probably get updated as soon as possible. For everyone else, there will be a new vaccine available probably towards the end of September, early October, that will more match up with current strains based on XBB. Now, the recommendation is people should get this vaccine kind of 6 months after their last infection or last vaccine, whichever is sooner. And the priority should be for those over 65, those who are immunocompromised, those who live in long-term care, who have medical comorbidities, or in other groups that put them at high risk. And those are the folks that really need to be encouraged to be front of the line to update their protection as that 6 month comes.
We have 1 minute left. Dr. Chagla, let me ask you about masking. Many of us are going to spend more time indoors as the weather turns colder, particularly in schools. What advice do you have there?
Yeah, it's not a bad idea. It reduces the risk. I think we leave it to people's decision making if they want to add those additional layers based on their risk, based on the people they're around. But certainly, you know, if you're going to use masking based on what's happening in the community, then this may be the time to start adding it on, along with the other layers of protection, like washing hands, staying home when sick, getting your vaccines, and accessing treatment if you're a high-risk person.
Our video link is not perfect, but as always, your information is rock solid, Dr. Chagla, so thank you very much for doing this.
Thanks.